Hello, I'm Cap Times local economy reporter Natalie Yar. Welcome to the Cap Times Idea Fest. I'm happy to be here to facilitate this conversation about pandemic fatigue, what it is, and what we can do about it. First, let me introduce our panelists. Dominique Brassard chairs the Department of Life Sciences Communication at the University of Wisconsin-Madison. She's an expert in public opinion dynamics related to controversial scientific issues, and she's interested in understanding the role of values in shaping public attitudes. Ajay Sethi is an infectious disease epidemiologist and a professor of population health sciences at the University of Wisconsin-Madison. He's worked in the areas of HIV/AIDS, COVID-19, healthcare-associated infections, and addressing public health misinformation. He's the faculty director of the Master of Public Health program, and he teaches the popular course, Conspiracies in Public Health. Welcome, both of you, and thanks for being here.
Yeah, thank you.
Thank you, Natalie.
So, Dominique, let's start with you, though I'd like both of you to answer this question. How would you explain what pandemic fatigue is?
That's a great question, Natalie, because I think that's something that we've seen in COVID in general and health issues in particular, is that people have a different understanding of terms. And in the case of what pandemic fatigue would mean to you may be different for what it means to someone else. In a nutshell, it means that people are beginning to discard information and the guidance related to COVID-19 because they're getting into a state of overwhelmness, and they actually decide that, to avoid dealing with things because literally they're tired of it.
And Ajay, would you add anything to that? I think that's a really interesting definition.
Yeah, I like that. And I'll say in general, I think people are going to feel fatigue if they have some expectation that life is supposed to be normal, as if it were 2018 or 2019. Things are clearly different right now, but things would be different now no matter what, 2-3 years after what we may still define as normal. So the pandemic is a big reason for things not feeling right now. But we've got a lot of other forces that are going on that are pandemic related in a lot of ways. And people are tired, and they've got a lot more uncertainty that we're living with. And I think that sometimes prevents people from feeling normal, so to speak.
Yeah. And Ajay, I'll have you take this one next. When it comes to the risks COVID poses, what really has changed since earlier points in the pandemic?
Yeah, I think the number one thing we have to all agree on is vaccination. We didn't have a vaccine at the start. We didn't even have a realistic timeline of when to expect a vaccine. And we're very lucky that one was authorized within a year of the pandemic. And we're also lucky that it ended up being as effective as it is in preventing severe illness and death. And that's probably the biggest game changer of the pandemic response. A lot of science we learned along the way, and it was important to learn those things, but having a vaccine is what really allows society to just start to move forward a little bit more.
Yeah. Dominique, anything you want to add on that?
Yes, I think Ajay made some excellent points. And I think to some extent, the fact that we had the vaccine, but not only several vaccines and several boosters, may actually contribute to the notion of pandemic fatigue. Some people eager to do well to protect their family and their community, got vaccinated right away. And then we told them you need a booster, and then we need another booster, and then your kid needs a vaccine and so on. And that idea that, it seems like we never do enough for this to move forward, I think is something it's a blessing and a curse at the same time. And honestly, I think from a communication perspective, calling them booster may be not the best. It may be like we never say a flu booster. You just need to get the flu vaccine every year. Like this is normal. This is not like a thing that you do and you don't do enough. You don't do it again. And I think to some extent, people had that expectation that, to go back to AJ's point about expectation, that they were going to get vaccinated and then it was going to be okay. So I think we need to think in terms of how can we, transition, even if we're still in a pandemic and we're hoping it's going to become endemic, how can we transition using terms that reflect that? How can we transition in using terms and communicate about this in a way that makes me feel that there is a transition, that it's not either pandemic or no pandemic. There's a transition time, and that we need to work, using the right terms to actually help doing that.
Yeah, that's really interesting. Do you think, Ajay, I'll have you take this to start. To what extent do you think that Americans' behavior and attitudes have changed appropriately in accordance to the changing risk? Like, things have gotten potentially less dangerous? Do you think we've just adjusted correctly to that, or we've gone too far?
This is a tough question to answer because overall things are safer now than they were in the beginning of the pandemic, but they're not safe for everybody. There's people still at risk for severe disease if they get COVID, or worse, they're at risk for death. And a big driver of that is not getting vaccinated, even up until this point. But we have people in society, who are older, their immune systems don't function as well. Maybe they have other comorbidities that complicate COVID if they were to get infected. And that's where we're seeing the most severity right now among those who are hospitalized and those who unfortunately die, even at this point in the pandemic. So, as far as adjusting behaviors, I think people who don't fall in those high risk categories clearly have been sort of adapting to COVID at more than 2 years after it first emerged. But there's some people who still need to remain vigilant for all sorts of reasons, or people who have family members who are in those high risk categories. And that's where I think, whether people appropriately have adjusted or changed their behavior, I think it just depends on some. Some people might be still stuck in the early perceptions of risk in the beginning of the pandemic and may still find things to be scary at the moment when maybe they're not as scary for them individually. Others, on the other hand, from the very beginning, never really embraced a lot of mitigation. So, it kind of varies. It's really hard to kind of answer that. I'm really curious what Dominique would say about this as well.
Yeah, absolutely. Dominique, and you talked about this period of transition now. What would you like to add here?
Well, I think Ajay made a good point that it's actually hard, for human psychology in general, like human beings in general. We should be careful not to have a one size fits all answer. There is a spectrum of attitude, a spectrum of behavior, a spectrum of resistance to messaging, a spectrum of everything, you name it. So as far as we reacting to the pandemic, as Ajay was saying, depending of your own locus of acceptance of a risk around you, you will use the behavior that's the best for you and your family, even if it's not the behavior that others around you think is the most appropriate. And so that means that, you have everything under the sun that, will be apparent. I just come back from Brazil. You were at airports where people were almost wearing a whole suit to protect themselves, and others that were not even wearing a mask, but all these were within the guidelines of public health because were not required for a mask. So your own, perception of what's risky really going to play. And let's remember that perception of risk really, even if we do our best to take into account public health guidance and so on, at the end of the day, they depend on what the pictures we have in our own mind, our own background, our own experience, our own tolerance, and so on. So I would agree with Ajay, very complicated question. And I think we need to be careful not to say yes or no, we have done this or that. It really depends on people, where they are, how their community reacts, how their family is, playing into all this.
Yeah. Yes, clearly there's a lot of variation. It's clearly very personal. How about for you two individually? Dominique, maybe you want to start on this. How are you personally thinking about COVID risks these days, and how have you changed your behavior over the course of the pandemic?
Yeah, well, that's an interesting question. I mean, like putting that doing a risk communication one-on-one class, since that's why I teach the psychology of risk and how to communicate risk. You would take my background, knowing that I was born in Argentina, raised in France, and so on. So I have a lot of cultural background. And so the way all the people that I know in all those countries became an impact how I feel. The fact that actually I teach risk communication, I know a lot about how people react, may color my way to actually, build my own perception of risk. The fact that I've been with Ajay in multiple panels, I heard about public health of it, epidemiology, all these things will color my reaction. This being said, taking into account all those variables, I think I would consider myself a middle of the ground person, in the sense that, if you consider the spectrum of people, you have people that are super risk averse for COVID, rightfully so because of their health issues, or rightfully so because they're concerned. And on the other hand, those that decided, I'm fed up, I'm going to turn the page, rightfully so if these are the public health guidance, and rightfully so if that's accepted in their community. I'm in the middle. So in that plane to Brazil, I was wearing a mask, and I was very careful to actually be like if I'm in a very crowded environment, to be careful. But at UW with my students and so on, I'm not wearing a mask and so on. So I would consider myself middle of the ground, considering that I'm firsthand, in contact with the latest research, the latest communication, and so on. But I'm curious to see what Adria has to say.
Yeah, again, it's hard to say. I definitely have taken more risks, if you will. But so for one, I don't know if I've had COVID in the past. I haven't tested positive, but I also haven't had a lot of reasons to test. And this is a virus that you can be asymptomatic, you can be infectious even though you're asymptomatic. So I don't know if I've had it in the past, but I've never tested positive for it. In some ways, that sometimes can serve like a little bit of an anchor for me to say, well, maybe everything I've done has helped me prevent getting COVID. On the other hand, I have no idea if I got it or not. So this is a tricky virus. I'll say that my personal thinking is, since I'm up to date on vaccination, I feel relieved that, I won't need to be hospitalized if I were to get infection. That if it happened, it would be surprising. And so because of that, I'm willing to not always wear a mask when I'm around people. Outdoors, I don't think I would, even if even if it were early in the pandemic, because we learned pretty early that the risk of outdoor spread is just not as high. It's really indoors when you have poor circulation, poor ventilation. And if I'm with somebody one-on-one, I'm going to forego the mask just because I think it's okay. I'm willing to get infected with the virus, but I am not voluntarily looking for it. So that's where, if I'm in a more higher risk situation, lots of people I don't know, very crowded, very hard to maintain space, yeah, I'm going to probably wear a mask. I wear a mask when I go shopping just because it's just not very hard to do. And I might as well just do it. There's probably pretty low risk in some of the places I go shopping because they're large, the ceilings are high, the ventilation seems pretty good, and people aren't really near each other. So I'm probably wearing masks at times when I probably don't need to wear them indoors, but I do because it's easy to do. And at the end, I'm relying on the fact that I'm up to date on vaccination to feel just generally safer than maybe a year ago when I had. I don't think I even had my first booster a year ago. That was when I completed the primary series. The first boosters came out sometime in November or October of last year. Yeah. So yeah, when it happens, when I know I have a breakthrough infection, that's where, I'll probably not like it, but I'm hoping it'll be very mild because that's the experience for most people.
Yeah, that's really interesting to hear you say that, and to, sort of acknowledge that some of the times, some of the things you might be doing are not necessarily 100% rational. I feel the exact same way about some of the things. I do certain things because I'm just like, well, I'd rather do it this way. It doesn't feel hard to do, and I might be reducing my risk a little bit or something like that. But I think that it gets at something that I found I was noticing early on, which was just, it meant different things. Being safe meant different things to different people. Like even people, I was mostly myself interacting with people who I think did take COVID seriously, were concerned about it, did want to do what they perceived was like the safe thing or the responsible thing. And yet what that meant to different people was potentially kind of different. And that we're probably still seeing that now, just playing out in a little bit different way.
Yeah, I'm going to also just add. So, like, I haven't seen my parents in a little while, and I will sometime, before the holidays this winter. And my dad's going to be 90 this fall, and my mom is also older. I wouldn't want them to get a breakthrough infection because they just may not handle it as well as somebody like me who's much younger. And before I see them, I'm going to shift my mindset a little bit. Make sure that I'm as infection free as possible, be going into that trip, trying not to be asymptomatically infected. I'll test frequently, I'll reduce my risk, I'll wear a mask before I head out, because I wouldn't want to be the one to give it to them, even though they're up to date on vaccination. It's just still, we know that the most frail are the ones who suffer the most with this virus, despite being vaccinated.
Absolutely. And Dominique, what would you like to add on that?
No, it's interesting because I think this is really something we see with perception of risk related to infectious disease, and even something that I know that we don't like to compare it to the flu, but I think it's important to do it as well at some point because this is going to become endemic. When you think about the flu, I had exactly the attitude that Ajay has right now with COVID in relationship to my dad. I always have the flu vaccine and so on. My dad is 90. I don't want him to get sick. I don't want to be, to make people that are really frail, getting into, having a disease that can be potential fatal. And I think this is really something we need to tell ourselves as we think about COVID and we deal with pandemic fatigue. It's okay for us to get pandemic fatigue because we can deal with it if we are up to date with our vaccinations, and so on, that our comfort zone with the risk has gone up. It's okay, but let's not forget that we do have people that are weak around us, and it's our duty to actually, even if we're comfortable within the risk, even if we know, I'm up to date with my vaccinations. And by the way, I did get the breakthrough infection. And even with the vaccine, it's not pleasant. I mean, I was home with 4 days of fever and so on. But even if we're comfortable with that, let's remember that a lot of people around us still are at risk. And I think this is the message we need to keep on harming people. It's okay to have pandemic fatigue. It's okay to have a higher tolerance for or risk related to you. But remember those around you. You also need to check on potentially, be detrimental to others.
Yeah. So I know the answer to this is always shifting. It might be different in a few months than it is now, but maybe Ajay, take this one to start. Is there an end in sight? If now is too soon for Americans to go back to normal, how will we know when it is time?
Yeah, I'll say for one thing, as COVID clearly is going to become more controlled in the future. And it should be seasonal at some point where it's spread primarily during those winter months, but we're just coming off a summer where there's this new variant. It starts to uptick a little bit. It's not behaving like a seasonal respiratory agent yet, but at some point we should expect less COVID in the non-winter months and more COVID in the winter months. So it still feels like a little bit of a roller coaster. And until we can string together a couple of respiratory bug seasons, flu seasons, if you will, where the pattern seems kind of predictable, then I'll say we're there. But to say that now, to predict that now is really hard, especially with a virus that has shown that it does evolve, that a new variant can emerge that might render our immunity less effective. And that's becomes a little bit of an issue. Again, I want to see what the next variant looks like, whether it's on the milder side, if it's less, if it's still manageable with our current tools. I think I might feel I can make those predictions with a little bit more confidence, but I think when people make predictions and they feel really strongly about them. I think I'd want to collect more expert opinions before I jump to my own conclusions and draw my own conclusions.
Yeah. Dominique, what would you add?
That also it depends where you are. I think it's also really hard to actually make predictions that are valid anywhere in the world, and even valid anywhere in the United States, or even valid anywhere in Wisconsin. You have pockets that, like, you have different type of attitudes, behaviors, and so on. And I mean, again, coming back from Brazil, where I was, like in Belém, when they still have very high rates of COVID, I think the pandemic is not really at the same level. It depends really of the level of vaccinations. We have some communities, we have way more people that are up to date and so on. So to AJ's point, it's very hard to make predictions and so on that would be valid in the grand scale. It's too complicated to make those predictions and take into account all the variables that need to be taken into account.
Yeah. Okay, I think this is one of the last questions on this kind of side of how close are we to normal. But Ajay, you had referred to like how so many things would be different now, even if the pandemic kind of wasn't still going on, and just kind of the way that all the things that are keeping us from being from feeling normal. And I would love for both of you to comment. Ajay, I guess I'll let you take it first. But on what is it that's keeping us from feeling normal apart from the continuing of the pandemic?
Yeah, I'll take the low-hanging fruit and say, no matter when the pandemic emerged or when we had a vaccine or where we are today in the pandemic, the elections that occurred in 2020 and now 2022 would have occurred anyway. And we would have been in this sort of period in society where, we're hearing things on TV and we're being polarized a little bit. And there's things that generally we don't want to hear all the time. A lot of things get politicized, not just this pandemic. And yeah, so, I'd say if we would be feeling those things if the pandemic weren't here. And I think the pandemic amplifies everything that we find irritable in society already. So I sometimes think it can be hard to separate, what is COVID specific versus what is it going on right now sociopolitically or climate change, climate events that have been occurring that make us feel worried about the future. There are a lot of things. So, I think feeling normal right now might be kind of just hard. We almost have to reset the way we think about what life is like right now and ask ourselves, where are things going well? Where are things where we feel uncertainty that's scary? And maybe rethink sort of what things are going to look like moving forward.
Yeah. Dominique, what would you like to add there?
Well, yeah, those are a very good point. And I'm going to go back to my answer about, we all differ on our way of what normal is or what normal is not. So, I think the dangers right now is like if you are in a community where people do not feel like you, whatever that feeling is, let's say, assuming that I'm very fatigued with the pandemic and I want to pretend it's not there, but everybody around me is not and makes me feel bad, or vice versa. I'm actually really scared of the pandemic somewhere where nobody else is scared. And then you feel you're not normal. I would just encourage all our listeners to know it's okay not to feel normal. It's actually okay. Just embrace your feelings. You feel the way you feel, and it's okay. Do what's best for you. And, and do not, I feel like right now, as Ajay was saying, we're bombarded by things in every corner, and we end up questioning our own sanity, thinking, am I overreacting? Am I underreacting? Am I this and that? And I think we need to own to ourselves. We deserve a little love with ourselves. We deserve to actually be able to actually take care of ourselves the best way we can. And that, and it's okay, because there's really no normal. There's a lot of different type of normals, and we need to acknowledge that we're doing the best we can. And I do think things are going to get better. So hang in there, everyone. And, it's, as Ajay was saying, there's that the notion of eco-anxiety with climate change, this and that and the other. But at the end of the day, there's so much good things happening. There's all those public health officials working on making us safe. There's all those grassroots organizations working for climate change. So look at hope and look at those stories that actually show you the good that we can do in the world. And that really helps. And that's going to make us feel normal again.
Yeah. And Dominique, I'll have you take this one first. The pandemic has clearly become very political, and many people believe that politicization has severely worsened the consequences of the pandemic. What advice do you have for Americans about how to process the pandemic and the news and commentary about it in a healthy way?
I would actually put a grain of salt on the yes, assessment that the COVID-19 was really political. It was, but it also was. Let's not forget, it was a big success as far as public health measures. We never had vaccines developed so fast with like huge clinical trials that were actually extremely well done. We have more than 75%, 70 something, Ajay, what are the latest number, that are vaccinated at COVID-19. This is actually a huge success. So keeping on saying that it's polarized and controversial, people disagree, kind of hide the fact that people came together, like the vast majority of Americans got vaccinated and so on. It could have been much worse. Obviously, we're not happy that we had 1 million deaths, but you know what? Actually, we did pretty well. President Trump did start the vaccine thing. President Biden continued. That's bipartisan. So I would urge us, instead of focus of things that bring us apart, looking at things that bring us together and see what we have accomplished, to say that it's not always by depicting things that are polarizing, we make them even more polarized. And I think we need to be careful when we do that. At the end of the day, we're all on this together. And let's look at the commonalities instead of looking at the things that bring us apart.
Ajay, what would you add there?
Nothing at all. I mean, the message of being hopeful and reminding ourselves that there was a lot of success can be hard, especially during an election season. I think Dominique said it perfectly. I was listening saying, I need to take notes. So I agree.
Yeah, that certainly, Ajay, you've mentioned to me before that, you're a little concerned about some of the comments sort of going the other way, folks. How do I want to say this? That some people are, maybe we could say, Monday morning quarterbacking the decisions made by public health officials earlier in the pandemic and trying to kind of rethink them. And so I guess first off, I'd ask, what do you think that the officials got right and where did they go wrong?
Yeah, I mean, I'll just sort of add that reflection is a really important part of learning. Without that, how do you sort of learn from experience? And there are a lot of agencies and people and groups out there who are evaluating the COVID response that took place. And it could be internal as part of quality assurance, quality control. It could be more, broader, thinking about how the country might respond to the next big threat. And then there are a lot of people out there who, have credentials. They also were part of the response in some way, maybe locally. And sometimes I think there's a habit to look back at how the response went and maybe forget the nuances in the timeline when new information emerged, how policies adjusted. And if you weren't in the trenches making those changes, maybe documenting the science and the policies, you might look back at the last 2 years a little bit blurry and at the end communicate a narrative that fits your worldview more than an objective look at history, recent history. And I see that. Sometimes, we just look at expert opinions that are out there. Some people are very critical of what the CDC did or what the NIH was doing or what the federal government was doing, or you name it. One, I think, piggybacking off of what Dominique said earlier, I think if you maintain a negative view of what overall was a success, you might be doing yourself more harm. Just, it's not good for your mental health to necessarily do that. Also, I think as a person who consumes information that's still out there, what I think is sort of revisionist history that's being made. I think there's a problem with sort of too much of that out there. It's a form of misinformation, and if it's spread deliberately, it's disinformation. And I think that's problematic. As far as I think we should just remember that at the beginning of this pandemic, there was this unfortunate latching on to flu as a model for how to communicate risks to the public. And I think it's reasonable because that's a respiratory agent everybody knows, but it probably would have been better to say, this is a new virus with a lot of unknowns, and let's just get through this together, and here's what we know so far. But by communicating that this was like the flu at the start, it created sort of an anchoring bias for a lot of people, and they still hold on to that notion. And it's even right now with the boosters. Sometimes when I get interviewed, people say, will boosters be given out like the flu shot every year? Is it going to be just like the flu? And it's like, well, maybe that's a good model, but let's talk about this in terms of COVID and what can we do to control COVID? So, in terms of the criticism that's been out there and sort of some key things that I think we have to remember is we didn't know it was airborne at the beginning. We went through a period of cloth masks until we realized it needed to be well-fitted N95s to prevent transmission. People might look back a little differently at that. I would say we didn't do a lot of testing at the beginning. We've never really had a great handle on cases as being a metric for transmission in this country, but we have to remember from the very beginning, we were told flattening the curve and preventing severe disease and death was our goal. So people still get hung up on cases not being representative of all cases. And I'll say, well, I don't think they ever were representative, and we've always been focused on preventing severe disease. And that's what the vaccines are doing right now. And let's just remember that. I'll stop there because I could go on forever with this topic. And and so I'll just, I'll react to what Dominique says. I'd love to hear what she has to say.
Yeah, and Dominique, before I pass it to you, I think just to be clear, in case anybody's wondering what we're talking about, we're talking about, for example, things like people who now say maybe they should never have closed the schools. Is that one example, or what are some of the examples of the kinds of things we're talking about here?
Yeah, so I mean, I think Ajay made an excellent summary of this type of reactions we see right now. And I have some examples that I'm using in my risk communication class, Ajay, also, and that are, I would say, far from being constructive. I mean, let's say my take on risk communication in general, COVID communication in particular, is like we need to be constructive and think about tomorrow. What can we learn from yesterday that can be applicable tomorrow? Not by saying we made mistakes or we should have, because should have, I mean, if we were who we were at the beginning of the pandemic, would we make the same decision as public health officials? Yes, because those were the decisions that were made at that time based on available knowledge, science knowledge, at that time. Always easy to say we should have, because we know now way more than we knew then. So it's not constructive. So what we can do though is like take into account what happened in the last 2 years, collection of data, see what happened, what worked, what didn't work. If we were to actually, God forbid, deal with a new pandemic, a new coronavirus or whatever, what are the things that we wouldn't know now, knowing what we know now based on an experience 2 years ago? So that's what we need to do. But obviously, saying now we should have done differently 2 years ago doesn't make any sense, because 2 years ago we didn't know what we know now. It's like saying, I regret what I did 2 years ago. My father gave me that advice a long time ago when I was a teenager. He said, if you were again who you were when you decided to do that, not knowing what happened today, would you have done it? I'm like, why, yes, of course, because I was me then. So you did the best available decision, based on the best available science. So let's say the revolutionism, is not constructive, is not helping, and at the end of the day, it hurts our communities because it may have impact on trust on public health officials, impact on trust on future, campaigns. So let's work together to be constructive for the future and not reinvent the past that we cannot change.
Absolutely. And Ajay, to jump back to one thing you said, you talked about how the question of how accurate the case count numbers are. And I certainly have wondered about this with so many more people home testing. And I'm just curious, like, as far as us being able to say, maybe try to compare, like, how worried should I feel right now based on the COVID case numbers in my community, and maybe how that compares. They still show you the charts, or I still see the charts that like compare this peak to a prior peak or whatever. And I'm just always wondering, like, well, what if way more people are home testing? Do I have accurate information to help me decide? And I'm curious, could either of you just comment on how we should think about that?
Yeah, I'll say that, like I said, from the very beginning, we've never had an accurate representation of all the cases in the community. But we've been able to interpret that data because we look at short-term changes in case counts. So if today we're ascertaining, 1 in 8 cases that are in the community, and if last week it was roughly the same 1 in 8, if it's going up, it's going up. You can feel pretty confident that risk is increasing if cases are increasing over short periods of time. But I'm not going to want to compare what's happening right now, September 2022 with September 2021, where we didn't have at-home tests, and it was just a very different culture or health seeking for testing, and types of tests were available. And that's where I think we fall into this danger zone of thinking, like, what's the pandemic like now versus earlier phases of the pandemic? We can definitely look at deaths. I think that overall, even though there can be problems with determining causes of death, eventually, those are the data that we use to determine the ultimate outcome for this disease. Hospitalizations as well, can be something that we can see as an outcome or something that's coded with relative consistency over a long period of time. Cases, not so much. So that's where short-term changes is what you can rely on. And that's what the CDC will do with their community level metric. And they also produce the community transmission. And public health is also interpreting that data. So I would say individuals in the community, you can take the burden off of yourself in getting lost in the numbers and just find out what local public health is telling you, because that's their job. That's what they're experts in. And I think that's probably the advice I would give anybody is trust your local public health officers.
Yeah. And in our last several minutes here, I will wrap things up by asking both of you to just think about what has and hasn't worked in the pandemic response, as we've spoken a bit about. Thinking about that, what can public health professionals and journalists like myself learn about how to communicate risk and help people make good decisions for this or for the next public health crisis? Dominique, do you want to start with that?
Yeah, so I actually think, and I would commend our local public health experts. They did an extraordinary job, like nurses on the ground and so on. So I would say, I would actually, maybe encourage our federal public health officer to listen more to the local public health officials, to have like more network that, like connects the ground with the top. Because I think, like, from my work on the COVID communication, we saw that that's what it was lacking. When at the local level, there was really extraordinary work, communities and public health officials coming together. I would also mention to everyone here that WHO, for example, has learned. I was on a panel last month with them where they actually are really focusing on listening to communities, being at the ground level, having more grassroots involvement with local health organizations, because they realize that it's really hard when you have a global pandemic like that. You have those, general measures that actually, when you translate it at the local level, may not fit the cultural context, the social norms, and so on. So I think, honestly, listen to the social scientists that are willing to work with you, having public health epidemiologists such as Ajay, social science like myself, doctors on the ground, nurses, journalists, work together. This is the best way we can, in the future, move in a productive direction, because we all have, the knowledge of one side of the coin, and putting our head together is the best way we can, ensure that communication risk is accurate. So networks of science journalists, epidemiologists, social scientists, public health officials, and so on, that we have established in COVID. And we wrote a paper about that, by the way. I hope these networks continue. We have, and that this way we can, respond and communicate with fast, effectively, and taking into account, what our communities really feel and want to be part of.
And Ajay, what would you add?
Again, not so much, but I'll say that, as far as what went well and didn't go well with the pandemic response, I'm just going to pick one thing, and that is the communication of uncertainty and saying, I don't know. There probably haven't been enough people willing to say, I don't know, enough times, but there are certainly expert communicators that have been part of the pandemic response who did that very well. But too many people, maybe when asked for their guidance, unwilling to say, I don't know, or maybe this is where I just have to remind myself and everyone that we're all human beings, and that when you wear the hat of an expert and when you wear the hat of a person also scared that you might get COVID, especially in the early part of the pandemic where this was that way, your response to a question or giving somebody guidance might be influenced by your personal fears and not necessarily on science that should force you to say, I don't know what the answer to that question is. And so sometimes I found people maybe saying things that weren't really evidence-based, but they were based on what they would like to see that makes them feel comfortable in the pandemic response. Again, people are human, so there's no one to blame here. It's just that, in your question of like, how do you help people make good decisions and what could have been done differently? I don't know what the answer to this. And this is where I want Dominique to actually have another final word here.
I was going to react to something because I was
please.
I cannot believe. Yeah, because you heard me talk about uncertainty. I was like, Ajay, thank you for mentioning the uncertainty part. But I would say to what Ajay is saying, it's critical, is that this includes scientists, life scientists. I think what we've seen that is very important for future, communication endeavors is that science also couldn't answer. So we could say, based on the best available science now, we think that, but, we don't know, maybe in a month, we'll know more from scientists' perspective. So I think also life scientists, acknowledging uncertainty, and it's something that it's extremely important when science moves fast. Scientific findings come as we move along in a pandemic, and and we adapt, and we have measures that are based in a science that's not settled. And I think we've been not as good as we could have been in making sure people understand science is a process, and the science is unfolding as the pandemic is unfolding. We say trust the science, but science was evolving as well. It's still evolving in a good way. We know more and more. But I cannot agree more with Ajay. This is an extremely important point.
Excellent. Thank you both. I want to thank you, the two of you, very much for making the time to be here today. And thank you to everyone watching. To see more Cap Times IdeaFest sessions, please visit captimesideafest.com or find us on YouTube.